I have actually several roles in my job in the emergency department. I am lucky enough that I get to go in when we have very ill patients and actually care for them hands-on with the other healthcare providers. So if we have a patient that comes in after a motor vehicle accident or with a stroke or a heart attack, I'm actually right in the room with the physicians and the nurses, helping them evaluate the patient and select and dose their medications, and then evaluate, how they're need to be changed and modified while the patients are in the emergency department, and then hopefully speed them through the department and to where they need to be cared for most appropriately within the hospital. I also oversee technicians within the emergency department who are working with us, talking to patients who are being admitted or who are on complicated medication regimens about their home medications. So they're responsible for collecting the complete medication list, including herbal medications and over-the-counter medications. And then we as the pharmacists evaluate those and help when the patients are admitted to evaluate whether those are the appropriate medications for the patients or not. I'm also responsible for any of the patients that are admitted through the emergency department to process their inpatient orders, evaluate their regimens, and make suggestions to the admitting physicians. So I not only get to work with the emergency department physicians directly, but I'm working also with the physicians on the inpatient side as well, very closely. And finally, the pharmacists are viewed as drug information resources in the emergency department. So we're constantly bombarded with questions from nurses, physicians. I work in a teaching hospital, so there are medical residents and students as well. So we're answering questions all day and really helping to guide the care of the patients while they're in the emergency department. I think probably the most rewarding part of my job is knowing that every day when I go into work, I'm going to get to impact patient care in a positive way and help them get cared for better and more safely. I think just knowing that there are pharmacists in a lot of emergency departments now is important for the public to know, especially. There's a lot of research that are showing that pharmacists can make a positive impact, and especially increasing patient safety. The emergency department is a very chaotic place, and oftentimes medication errors can happen, unfortunately. And one of our roles is to make sure that that doesn't happen. So the emergency departments that have pharmacists staffing in the emergency department, they're going to be a safer place for the patients.